In just about every video I post, I get asked or told that Medicare Advantage is bad. So I just want to go over some pros and cons to Medicare Advantage and let you make an informed decision, because that's going to be the most important part when you're enrolling into Medicare or deciding to make a change. So to the trusty whiteboard, the age-old discussion is Medicare Advantage good or bad? Starting off with the pros, you're going to have a lower cost. Most of the time it's actually going to be $0 for most plans in most areas. It's also going to be bundled and you will have additional benefits. So these are going to be things like dental, vision, hearing, prescription drug plans, over-the-counter benefits as well. You're also going to have a lot of chances to change your plan. During AEP or OEP, you can make changes to your current Medicare Advantage plan if that's something you want to do. And it's definitely a good idea to look at it each year with a Medicare advisor. And then lastly, you're going to have a maximum out of pocket. Now, this will be higher than if you go the Medicare supplement route, but it does cap what you will be spending on your Medicare coverage for the year. And for the cons, which is what I hear about all the time, you're going to have copays, which these tend to not be a huge deal. If you go to your PCP, most of the time it's going to be $0. And for a specialist, it'll be anywhere between 20 to 35. If you go the HMO route, you will have to worry about networks. Even if you do go with a PPO, my job as an advisor is to make sure you're staying in network to keep your costs down as much as possible. But if you are a senior who loves to travel, then this will be a super important decision that you have to make if you're okay with the networks. And probably the biggest problem that seniors tend to see is getting prior authorization for some bigger surgeries. That tends to be the biggest pain point that I see from seniors. Another is going to be cancer coverage. You will be on the hook for 20% of the chemotherapy and radiation. So that is something that you can cover by getting a critical illness plan or a cancer plan that is standalone. That's a great option. And then again, it's going to be that annual shopping that you're going to have to worry about. That can either be a pro or a con depending on how you look at it. So overall, these plans act pretty similar to group coverage or ACA coverage. It just depends on if that's something that you're comfortable with. Feel free to let me know what you think of Medicare Advantage. Either way you go, it doesn't hurt my feelings. I see people go both Medicare Advantage and Medicare Supplement. My job is to make sure they have the most informed decision, and I can help supplement anything that they need the best I can.